Hello guys, we are the group 10 and today we're going to talk about the skeletal. Human skeleton. This is the internal skeleton that serves as the body's framework. This framework consists of many individual bones and cartilages. There are also bands of fibrous connective tissue, the ligaments and the tendons. The functions of the skeleton are the three different types: support, protection, and motion. The human skeleton consists of two principal subdivisions, the axial and appendicular. First, the axial, comprising the vertebral column, the spine, and much of the skull. And second, the appendicular, to which the pelvic and pectoral girdles and the bone and cartilages of the limbs belong. In this topic, as part of the axial skeleton is a third subdivision, the visceral, comprising the lower jaw, some elements of the upper jaw, and the branchial arcs, including the hyoid bone. The central nervous system lies largely within the axial skeleton, the brain being well protected by the cranium and the spinal cord by the vertebral column by means of the bony neural arcs. A distinctive characteristic of human as compared with other mammals is erect posture. Erect posture has created a number of mechanical problems, in particular weight bearing. These problems have had to be met by adaptations of the skeletal system. The body is to some extent like a walking tower that moves on pillars represented by the legs. Protection. Protection of the heart, lungs, and other organs and structures in the chest involves motion, expansion, and contraction. Must have a flexible and elastic protective covering. This covering is provided by the bony thoracic basket or rib cage, which forms the skeleton of the wall of the chest or thorax. The third general function of the skeleton is that of motion. The great majority of the skeletal muscles are firmly anchored to the skeleton, usually to at least two bones and in some cases to many bones. Thus, the motions of the body and its part, all the way from the lung of the football player to the delicate manipulations of a handicraft artist or of the use of complicated instruments by a scientist, are made possible by a separate and individual engineering arrangements between muscle and bone. Next, we have the introduction to axial and visceral skeleton. The axial skeleton system is the brain skeleton that forms the skeletal system of the head and trunk of the human body, while the visceral skeleton system refers to the splunchon cranium region of the human skull. They form the hyoid apparatus and the thyroid cartilage. The cranium, the part of the skull that encloses the brain, is sometimes called the brain case, but its intimate relation to the sense of organs for sight, sound, smell, and taste, and to other structures, makes such a designation somewhat misleading. The cranium forms all the upper portion of the skull, with the bones of the face situated beneath its forward part. It consists of a relatively few large bones: the frontal bone, the sphenoid bone, two temporal bones, two parietal bones, and the occipital bone. The frontal bone underlies the forehead region and extends back to the coronal suture, an arcing line that separates the frontal bone from the two parietal bones on the sides of the cranium. The cranium is formed of bones of two different types of developmental origin: the cartilaginous or substitution bones, which replace cartilages performed in the general shape of the bone, and membrane bones, which are laid down within layers of connective tissue. For the most part, the substitution bones from the floor of the cranium, while the membrane bones from the sides of the roof. It consists of relatively few large bones: the frontal bone, the sphenoid bone, two temporal bones, two parietal bones, and the occipital bone. The interior of the cranium. The interior of the cranium shows a multitude of details reflecting the shapes of the softer structures that are in contact with the bone. The internal surface of the vault is relatively uncomplicated. In the middle, in the midline, front to back, along the sagittal suture, the seam between the two parietal bones is a shallow depression, the groove for the superior longitudinal venous sinus, a large channel for venous blood. A number of depressions on either side of it mark the sites of the Pacchionian bodies, structures that permit the venous system to absorb cerebrospinal fluid. The large thin-walled venous sinuses all lie within the cranial cavity. While they are thus protected by the cranium, in many places they are so close beneath the bones that a fracture or a penetrating wound may tear the sinus wall and lead to bleeding. The blood frequently is trapped beneath the outermost and toughest brain covering, the dura mater, in a mass called a subdural hematoma. Clearly visible marks on the internal projecting surface of the sphenoid, called the greater wing, and on the internals of the parietal and temporal bones are formed by middle meningium and its branches, which supply the envelopes. Injury to the vessels may lead to extradural hematoma, a mass of blood between the dura mater and the bone. Unlike the vault and flanks of the skull, base represents an extremely complicated appearance. It is divided into three major depressions or fossae in a descending stair-step arrangement from front to back. The fossae are divided strictly according to the borders of the bones of the cranium, but are related to major portions of the brain. The anterior cranial fossa shows a crest-like projection on the midline, the crista galli. This is a place of firm attachment for the falx cerebri, a subdivision of dura mater that separates the right and the left cerebral hemispheres. On each side of the crest is the cibriform bone ethmoid, an important median bone that is part of both the skull and the brain. Through the perforations of the plate run many divisions of the olfactory or first cranial nerve coming from the mucous membrane of the nose. On sides of the plate are the orbitals of the frontal bone, which form the roofs. And now we have the thyroid. The primary function of hyoid bone is to serve as an anchoring structure for the tongue. The bone is situated at the root of the tongue in front of the neck and between the lower jaw and the largest cartilage of the larynx or voice box. It has no articulation with other bones and thus has a purely anchoring function. The hyoid consists of a body and a pair of larger horns called the greater cornua and a pair of smaller horns called the lesser cornua. Other muscles attached to the hyoid bone are the two mylohyoid muscle, which from a sort of diaphragm from the floor of the mouth, the thyroid, and the almohyoid, which originates from the upper margin of the shoulder blade and from a ligament, the suprascapular ligament. At the beginning of a swallowing motion, the geniohyoid and mylohyoid muscle elevate the bone and the floor of the mouth simultaneously. These muscles are assisted by the stylohyoid and digastric muscles. The tongue is pressed upward against the palate, and the food is forced backward.
So, hello everyone. I am going to report about the upper jaw, the lower jaw, the spinal cord, and the vertebral column. But before anything else, let me just define first what is jaw. Jaw. It is either of a pair of bones that form the framework of the mouth of the vertebrate animals, usually containing the teeth and including the movable lower jaw, which is the mandible, and fixed upper jaw, which is the maxilla. The function of the jaws is by moving in opposition to each other and are used for biting, chewing, and handling of food. So we have this alveolar margin that contains the alveoli or the sockets in which all the upper teeth are set. It also forms the lower part of each of the maxilla. So first one, let us define or let us tackle about the lower jaw. The left and the right halves of the lower jaw, or as what we called as the mandible, begin originally as the two distinct bones, but in the second year of life, that two bones begin to fuse at the midline to form as one. This lower jaw, the function of the lower jaw or the mandible is to support the bottom row of the teeth, and it gives shape to the lower face of the chin, and it is also the bone that moves as the mouth opens and closes. We also have this zygomatic arch that form the cheekbone, or as what we call as the zygomatic bone. This cheekbone or zygomatic bone or malar bone, it is a diamond-shaped bone below the lateral to the orbit or the eye socket at the widest part of the cheek. It adjoins the frontal bone and the outer edge of the orbit and the sphenoid and the maxilla within the orbit. So, so in the human fetus and the infant, both of the upper and the lower jaws have two halves. So these two halves fuse together at the midline or in a few months after the birth. So um, the next one is the upper jaw. This upper jaw is formed by the roof of the mouth and the parts of the eye socket and also the nose. So the upper jaw is firmly attached to the nasal bones at the bridge of the nose, to the frontal, to the lacrimal, to the ethmoid, and to the zygomatic bones within the eye socket, to the palatine and the sphenoid bones in the roof of the mouth, and at the side by an extension to the zygomatic bone, or as what we call as the cheekbone. So it also forms the anterior portion of the zygomatic arc. So the function of the upper jaw is to hold the upper teeth. It also shapes the middle of the face and supports the nose. So let's go to the spinal cord and the vertebral column. First, we will tackle about the vertebral column. So vertebral column is also called as the spinal column. It is also the spine or the backbone in vertebrate animals. It is the flexible column extending from neck to tail, made of a series of bones which are the vertebrae. So together, the centrum and the neural arc surround an opening, the vertebral foramen through which the spinal cord passes. So, the vertebral column provides attachments to muscles, supports the trunks, protects the spinal cord and nerves roots, and serves as the site for hemophoesis. And in human structure and function of the vertebral column, it can be affected by the certain diseases. disorders, or even injuries. Examples includes the scoliosis, the lordosis, and the kyphosis, which are deviations from the normal spinal curvature. Degenerative diseases such as the osteoarthritis and the Bass-Up disease and tuberculosis of the spine, which is caused by the infection of the vertebral column by Mycobacterium tuberculosis. So we also have the spine. This spine connects your brain or the spinal cord. It connects your brain to your lower back. Our spinal cord carries nerve signals from our brain to our body and vice versa. The spine is also made up of a column of bones which we call as the vertebrae or the spinal column. The spinal cord, it is a long fragile structure contained in the spinal canal which runs through the center of the spine, and it is protected by the vertebrae.
So, good day. My name is Chesar Daneza, and I am going to discuss the part of long bones of arms and legs. First, the human and the femur are corresponding bones of the arms and legs, respectively. While their parts are similar in general, their structure has been adapted to differing functions. The head of the humerus is almost hemispherical, while that of the femur forms about two-thirds of a spear. Second, the forearm and the lower leg. As you can see, have they have two long bones each. In the forearm are the radius on the thumb side of the forearm, and the ulna in the lower leg are the tibia or shin bone and the fibula. Third, at the elbow. The ulna forms with the humerus are true hinge joints in which the action are flexion and extension. In the position of the arm called supination, the radius and ulna are parallel. The palm of the hand faces upward, forward, and the thumb is away from the body in the position called pronation. The radius and the ulna are crossed. The palm faces to the rear and the thumb is next to the body. So next is the hands and feet. The skeleton of the wrist or corpus consists of 8 small carpal bones, which are arranged in 2 rows of 4 each. The skeleton of ankle or tarsus has 7 bones, but because of the angle of the foot to the leg and the weight-bearing function, they are arranged in a more complicated way. So, the hand is a versatile and fine-tuned instrument. The thumb with its skeleton, first metacarpal bone and 2 phalanges play a crucial role in this. Aside from flexion, extension, abduction, and adduction, which are all exercised to varying degrees by the big toe, the thumb can also be brought across or opposed to the palm and the tip of the slightly flexed fingers. This motion provides the foundation for working with tools, weapons, and instruments. The skeleton of the arms and legs, the outer portion, is specialized and consists of elongated portion made up of chains or linear series of small bones. In human, the metatarsal bones, those of the foot proper, are larger than the corresponding bones of the hands. The metacarpal bones, the tarsal and metatarsal, form the arch of the foot, which give it strength and enable it to act as a lever. The shape of each bone and its relation to its fellow are such as to adapt it for its for this function.
your low back through the middle of your spine. So it's a fragile system made up of a nerve bundles and cells that transmits instructions from your brain to the rest of your body. So your spinal cord is a vital component of your neural system. People often refer to the spinal cord and vertebral column together as the spine. So your vertebrae stack on the top of each other, from your pelvic bones to your skull. Between each pair of vertebrae, you have a spinal disc. So this brain, for my examples, your spinal cord manage your patellar reflex. So if you're moving your leg when someone taps on your chin, I shine in a certain spot. So the anatomy of the spinal cord is the cervical nerves C1, C8. So the nerves is named by the vertebrae below. C for exists at IVP between C3, C4 vertebrae. So the thoracic nerve is a T1 and T12. The nerves is named for the vertebrae above. T6 exists at the EVP between T6 and T7 vertebrae. So the lumbar nerves is the L1 and L5. The nerves is named for the vertebrae above. L1 exists at the IVF between L1 and L2 vertebrae. So ang spinal cords are the injury of is a complete or a partial damage to the spinal cord that causes permanent changes in the sensation and the loss of voluntary control below the sites of injury. So our spinal cord is a very important part of our central nervous systems, the overall system that controls and coordinates the activities of our bodies. So our brain is surrounded by skull. Whole our spinal cord is surrounded by rings of bone called vertebrae, and both are covered by a protective membrane together. The vertebrae in a membrane made up of our spinal column or our backbone. So yes. So the rib cage is made up of 24 ribs, 2 sets of 12, which are connected to the sternum, a large, flat bone at the center of the chest. So the ribs are joined to the sternum by a cartilage, a strong, slightly flexible substances. So the rib cage protects the organs of the chest, such as the heart, lungs, from injury. So the rib cage is a basket-like skeletal structure in the vertebrae anatomy that comprises the chest or thorax and is made up of the ribs and their corresponding attachment to the sternum, like monang breastbone, and the vertebral column. So the rib cage covers the lungs and the heart, providing significant bone protections for these vital organs. So two ribs are the first 7 ribs in the rib cage that are linked to the sternum by malleable cartilage called the costal cartilage. So, spinal cord is the structures of the rib cage. In our body, the framework of the chest is called the thoracic cage, or in a common terminology, the rib cage. Its design functions to protect vital organs such as our heart and lungs, and also nagaprovide siya points of the attachment for many muscles. So the thoracic or the rib cage is comprised of the 3 main parts: the sternum, ribs, and the thoracic vertebrae. So the first 3 of the remaining 5 ribs, known as a false ribs, have the costal cartilage attached to the cartilage above them. So the cartilage of the final 2, the floating ribs, finish in the muscle of the abdominal wall. So in the next, the appendicular skeleton is a part of the vertebrate skeleton that consists of the bones that support the appendage. So there are 126 in bones in all. So the appendicular skeleton contains the skeletal parts of the limbs as well as the shoulder girdle and pelvic girdle that supports them. So the term appendicular is an adjective of the noun appendage, which indicates a portion that is connected to something bigger. So the structures of the appendicular system, the appendicular skeleton contains 1/26 of the 206 bones in the human skeleton. So the appendicular skeleton is engaged in mobility, lower limbs of the axial skeleton, and manipulations of items in the environment, the upper limbs. So the appendicular skeleton develops from cartilage throughout the development through the process of the endochondral ossifications. So, ang appendicular skeleton is it allows us to move and manipulate objects. So, appendicular skeleton is really important. Basically, that's right out of the gate 8. So, now the appendicular skeleton is connects with the axial skeleton. So the sternum or breastbone is a part of the axial skeleton, but the clavicle is connected to the upper part of the sternum, known as the manubrium. So the pectoral girdle and the pelvic girdle is stabilize the upper limbs and the thorax and allows for shoulders mobility. These functions are hampered by malformations which distort and the appearance of the upper chest and the back. By articulating with the spine, the pelvic girdle transfers upper body weight to the lower limbs. So malformations can distort the appearance of surrounding body structures like buttocks, but they can also interfere with weight bearing and ambulations. Malformations can occur in any of the two greatest bones for your joints. So the pelvic girdle is made up of paired hip bones called ilium, ischium, and pubis. So the pectoral girdle is a component of the appendicular skeleton, which is responsible for the upper limbs. In humans, the pectoral girdle is made of the scapula and clavicle. The pelvic girdle is located in the trunk's lower third. So, the pectoral girdle, also called a shoulder girdle, connects the arms to the body. Nagaprovide po siya base for arm movement. So, pectoral girdle sometimes referred commonly as a shoulder girdle, and it basically connects our arms to the body. Gibalik na ako. And it provides the base for arm movement. So, the pectoral girdle consists of two clavicles and two scapulae. Thank you.